Hi, Joyce O'Shaughnessy. I'm the Celebrating Women's Chair in Breast Cancer Research at Baylor University Medical Center, Texas Oncology, and U.S. Oncology in Dallas, Texas. The issue of the safety of alcohol in women who are now breast cancer survivors is a very important issue, and one that I talk about at length with all of my patients at the time of their breast cancer diagnosis. It falls into the category of lifestyle factors that are modifiable that can actually improve the outcome of women who have developed breast cancer. Before I speak about women who are now breast cancer survivors, I'd like to talk about the impact that alcohol has on the incidence of developing breast cancer. Is alcohol a risk factor for developing breast cancer? And the answer is a definitive, clear yes. It is. It's a very important risk factor for developing breast cancer, and may in fact be responsible for somewhere in the order of 8 to perhaps 12% of breast cancers that develop globally. So it has a very large impact. So if alcohol were not a consideration, if it did not exist in our world, then there would be less breast cancer. 8 to 12% less breast cancer can be attributable to alcohol intake. It's clear that there's a sort of a stair-step dose relationship. The more alcohol that is consumed, the higher the risk for breast cancer. So 2 drinks per day is higher risk than 1 drink per day, is higher risk than less than 1 drink a day. What is unfortunate is that there is no lower limit of alcohol intake that is entirely safe, that does not raise the risk a little bit. So even a couple of alcoholic drinks per week is associated with a small increase of risk, if it persists over some years. But it's very clear that the greater the alcohol intake, the greater the risk of breast cancer. And this is true whether the alcohol is beer, wine, or spirits. And 1 alcoholic drink is between 12 and 14 grams of alcohol a day. That's about 1 drink is about 12 to 14 grams of alcohol a day is considered 1 alcoholic drink. So it doesn't make any difference which kind of alcohol it is. Why is alcohol a carcinogen? Alcohol is converted to acetaldehyde, which damages DNA. It's a very highly reactive oxygen species. Reactive oxygen species damage proteins in cells and damage DNA in cells. So it actually is causing mutations in our normal breast cells. Our normal breast cells are under hormonal influence, whether we're premenopausal or postmenopausal. The postmenopausal breasts actually they generate a lot of their own estrogen, even though a woman is after the menopause and the ovaries are not making much, if any, estrogen. The breasts make estrogen. So the breast cells are under constant hormonal stimulation. And so then coming in with alcohol, which is a carcinogen, which is damaging those cells as the cells, particularly pre and perimenopausally, are being stimulated through the menstrual cycle, is actually a way that's very damaging. In fact, it has been shown that the amount of alcohol that women drink in their younger years, when the breasts are still in development, through teenage years, adolescence, and into early adulthood, before a woman has her first full-term pregnancy, is more damaging than alcohol consumed later in life, although it's still all is a risk factor because the acetaldehyde is very potent carcinogen. In addition, the alcohol increases the amount of circulating estrogen in women. Instead of the estrogen being excreted from our bloodstream through the liver out through the GI tract, the alcohol is reabsorbed in the gut after it's excreted through the liver, when there's alcohol in the gut, the alcohol solubilizes the hormones, including estrogen, and leads to the reabsorption through the gut into the bloodstream, raising the levels of not only estrogen, but other hormones, which again can support the proliferation, the cell division of the breast cells, which is not a good thing when alcohol is causing damage to the DNA. So it's a very, very potent carcinogen. So it's very, very clear that alcohol raises the risk of developing breast cancer. But what about when a woman has already developed breast cancer and is at risk for having micrometastatic disease? Is there a risk to her for drinking alcohol? Here, the data are less clear. And I think part of the reason is that the studies were done with women variably on a hormonal therapy. And some of the studies are old and they don't include our most potent endocrine therapy, such as the aromatase inhibitors or the addition of an LHRH agonist to endocrine therapy in premenopausal patients. If you look at the older literature, my evaluation of it, my conclusions are that there is an association with an increase in the risk of breast cancer recurrence with alcohol intake overall. And again, I believe it looks to me like it's in the same schema that we talked about with the causing breast cancer in the first place. The greater the amount of alcohol intake, the higher the risk of developing a recurrence of breast cancer. And so I tell my patients to drink less than one alcoholic drink per week. There's still some risk with drinking less than one alcoholic drink per week, but the risk really goes up if women get above one alcoholic drink per day on average. Having said that, the data are more muddy in patients who are breast cancer survivors. Some of the reviews that have looked at the totality of the data really conclude that it's a gray zone and no clear guidance can be given. So that is the conclusion of some scholars, but my evaluation of the data does show that some studies are very well done studies, really show a clear association with breast cancer recurrence in patients who are breast cancer survivors and alcohol intake. So I think it's just prudent for women to be very cautious with alcohol. You know, for example, if a woman's on an aromatase inhibitor, her body is still producing some estrogen. And so increasing the estrogen levels because of the absorption of estrogen from her gut in the context of alcohol would potentially increase her risk because her estrogen levels would not be fully suppressed with the aromatase inhibitor, for example. Plus the fact acetaldehyde is a very toxic damager of cells. And when women have micrometastatic disease, if it's not been killed off with the chemotherapy or the endocrine therapy and it's in a dormancy state, it's very important for those cells to stay dormant and not to be wounded by carcinogens such as alcohol. And so I think it's just very prudent for women to be very cautious with alcohol who are breast cancer survivors. I don't think women have to avoid alcohol altogether, but I do think it's prudent to have less than one alcoholic drink a day on average. I think women during their actual chemotherapy, you know, for example, in the neoadjuvant or adjuvant setting, I think that most women don't drink alcohol because they oftentimes don't feel that alcohol is appealing to them during chemotherapy. And so generally speaking, women don't tend to drink very much during chemotherapy. It's not unsafe to do so. The chemotherapy can have some effects of toxicity on the liver. It's generally very modest and transient, however, so it's not unreasonable to have the occasional alcoholic beverage during chemotherapy, but one would want to minimize it just because the chemotherapy itself can be toxic to the liver. So that's the story as we know it today for alcohol. Overall, I think there's a real strong cautionary note, certainly in our premenopausal years with alcohol consumption. Also in our postmenopausal years, drinking less than one alcoholic beverage a day is a prudent health strategy. Drinking as little as possible is the best. And then after breast cancer diagnosis, I think the same guidelines are safest, to drink less than one alcoholic beverage a day if one drinks at all.